So looking now at some pathologies involving the ear, here is auricular hematoma or cauliflower ear, very commonly seen in wrestling combat sports. What you essentially have happening here is any repeated trauma or friction to the soft tissue around the ear. And what happens is from the friction rubbing between the skin and the cartilage of the ear, you get some bleeding and then eventually the formation of scar tissue. You can see in the picture illustrated on the slide a pretty significant case of cauliflower ear. So if individuals do get this initially, there are some ways that you can avoid the actual hardened scar tissue. Your book will talk about some of the treatment. You can include that in your signs and symptoms chart. The easiest way to prevent this is just wear some sort of headgear. So wearing the headgear would prevent the friction trauma to the ear tissue. Ruptured tympanic membrane or ruptured eardrum. So this will occur due to sudden pressure changes in the ear. You can actually see a picture of this on the slide. So when you would look in the ear with the otoscope, this is what you would actually see. So if you remember that, you can see here the actual hole in the eardrum. You can actually look in and see the bones inside the ear. This would usually happen in athletics due to a direct blow to the ear. I had this happen to a basketball player who got hit. She got hit with a basketball. Someone went to throw a pass. She didn't see it. It actually hit her in basically the side of the head, and the pressure from the ball hitting her ear just in the right spot, the pressure change caused her eardrum to rupture. So she had this occur. Other things that could happen, be less likely happen, obviously if a foreign object went into the ear, it could do this. It could happen in individuals who don't regulate their pressures from airplanes or just loud noises in general. But this is what you would see, and you'd have to refer to a physician to determine if it would have to be repaired or not. Otitis externa, or an ear infection of the ear canal. So this would be something caused by typically exposure to water. This is also known as swimmer's ear. Swimmers get this a lot because they get water stuck inside their ear, and it basically causes the infection to occur. It can be either bacterial or fungal. So you can kind of see in the picture is kind of illustrating what portion of the ear. So it's the actual ear canal that gets infected. The tissue gets irritated, inflamed, and you get either the proliferation of the bacteria or fungus. The prevention for this, obviously earplugs to keep water out of the ears, just making sure you keep the ears dry. Sometimes swimmers like to put, there's different types of solutions they could put in their ears after they swim to kind of get the water out, or even just a little bit of rubbing alcohol could do that. And avoiding the use of swabs or sticking Q-tips actually into the ear canal, just because of the trauma and irritation that could cause. Then you have otitis media, which is a middle ear infection. So the infection is kind of based upon where the actual inflammation takes place. So here, the infection actually affects the area involving the actual eardrum. So if you look here, you can see the swollen tympanic membrane, the redness around it on the picture. Again, compare and contrast to what we had discussed earlier is the normal eardrum. So again, normal eardrum should be nice and translucent. It shouldn't be filled with fluid. It shouldn't be bulging. It shouldn't be withdrawn or sucked in. Either way, that's what you'd be looking for. If you saw this, you can see the picture on the left. Very swollen, purulent eardrum with fluid behind it and a lot of redness around there. That's indicative of the middle ear infection. Commonly, you would see this many times, particularly in younger individuals. It follows an upper respiratory infection. So it's not uncommon for someone to get a cold and then to possibly have it transition into an ear infection. Impacted cerumen, so this is basically just a buildup of earwax inside the ear. So some people do just naturally produce a lot of earwax, and that could cause it to kind of back up. You see in the picture there, again, you'd look in with the otoscope, and basically what you would see is a big buildup of earwax. Really, again, prevention-wise, not using cotton swabs. The problem with cotton swabs is they push earwax back into the ear. So it's suggested that if you do get some buildup outside the ear canal to clean your ears, ideally you would just use a washcloth just around the outside part of the ear, because you don't want to push any of it back into the ear. Ideally, the wax just kind of naturally sloughs off and kind of leaves the ear. If you do have to clean it, again, that the washcloth is your best option. Using the cotton tip swab, it does have a greater tendency to push this in. The issue here, in addition to the fact it's just kind of annoying and uncomfortable, is it could predispose somebody to an infection. So if someone gets a lot of buildup of wax inside the ear, and then they get water in there on top of it, so if somebody goes swimming, they already have a big buildup of earwax, it could cause the water then to get in there as well, which would be a very good breeding ground for an infection to occur. Epistaxis, or nosebleed, various different types of causes to this. So trauma, infection, dry nasal passages, allergies, hypertension, are all different things that can cause nosebleeds. They should be fairly easy to control, and your textbook should have some different ways to control nosebleeds, and in class we could even talk about some other tips that you can utilize in doing this. The only thing to be aware of is if they become frequent with no real known cause, it would be a good idea to refer an individual who has frequent nosebleeds. Allergic rhinitis. So allergies can occur in people. They can occur seasonally, typically in response to large amounts of pollen in the air. They can be perennial, meaning they can be throughout the year because people are allergic to things such as animal dander, dust, mold, things of that nature. Or people could have both. It all relates back to, as we discussed earlier in the year, we discussed this in the immune system chapter, it's just an abnormal response to histamine. So the abnormal response to histamine produces the reaction in the body where you then end up getting the symptoms that occur with allergic rhinitis. Sinusitis is an inflammatory condition of the mucous membranes that line the sinuses. If you look at the illustration, you could see the sinus regions that are affected by this. It could be either caused by a bacterial or viral infection. Again, this is something that would come in conjunction many times with just like a general upper respiratory infection or a really bad cold. So as far as treatment for this, it's important to note that if a sinus infection is caused by a virus, an antibiotic is not going to be effective for it. So you have to make sure to note that it is a bacterial sinus infection before taking an antibiotic. Different types of throat infections. So it's important to note that with all of your throat infections, it's usually associated with some other pathology. The big one here that we would obviously be concerned about many times is a streptococcal infection, or what's known as strep throat. So that would be something that, based off of the signs and symptoms. So again, note, very important to kind of track all the signs and symptoms for your chart, because how a sore throat would be managed could just depend upon the time frame that the individuals had the sore throat for and what other symptoms they have. So as far as the terminology goes, so pharyngitis is obviously an inflammation of the throat. Tonsillitis is inflammation of the tonsils. Again, the cause could be either bacterial or viral. You can normally, by looking, kind of see where the infection is, and kind of in conjunction with some of the other signs and symptoms. So very important to note that. Laryngitis is an inflammation of the larynx, so that's going to be what affects the actual voice box. So this could be something that can be caused, again, by infection, or could actually be caused by just a general strain to the voice box in general, and that would produce difficulty or even inability to speak. And then just be aware of the different infections of the mouth. Again, you're not really going to be seeing this a ton, but it is important to just have a basic idea. Gingivitis is a bacterial infection of the gums. So again, with all of these, just be aware of the particular signs and symptoms and where the inflammation occurs. So gingivitis is an inflammation of the gums. Periodontitis occurs when the inflammation from gingivitis and the infection from it spreads to the ligament and bones that support the teeth. So you have your ligamentous soft tissue structures that support the teeth. If that does spread from the infected gums, it could cause some problems with the teeth as well. Dental caries just involves tooth decay or cavities. On the picture here you have oral candidiasis, which is a fungal infection of the mucous membranes of the mouth. This is also known as thrush. You see a case of it here with on the tongue, the kind of thick white plaquey patch that kind of forms along the tongue. And then you have oral cancer as well, which we're going to talk about more in depth on the next slide. So oral cancer, so just kind of a little discussion point question for yourself and looking at this that you could connect with your reading in the textbook. So there's an obvious specific habit where there's a direct link with this. And just thinking about that, you can probably figure that out. If not, you can look in the textbook. There's also a connection with a version of the human papillomavirus that is also linked and to be a cause of oral cancer as well. In a situation with this, it's usually not the cancer itself, but the treatment for it that may inhibit participation status. So if an individual did develop oral cancer, you would have to look at what their treatment would be and whether or not that would limit or prevent their physical activity. And here is an outline list of your learning outcomes. Again, just on your signs, symptoms, treatment chart, again, just make sure you're very specific for the treatments and the management of all of the different conditions so you have those outlined for studying purposes.